5 urgent warning signs your body needs a doctor, especially after 60. Aging is a natural process that affects everyone. But it doesn't mean you have to feel like you're getting older. As we age, our bodies change in many ways, and sometimes these changes can be warning signs that something is wrong. Here are 5 urgent warning signs your body needs a doctor, especially after 60. If you notice any of these signs in yourself or someone you love, don't hesitate to seek professional help. With early detection and treatment, many of these conditions can be managed effectively, and you can continue to live your life to the fullest. No one. Sudden changes in bladder function. As we age, it's common for bladder function to change gradually. However, sudden changes in your bladder habits may be a sign of an underlying issue that requires medical attention. For example, if you suddenly find yourself needing to urinate more frequently, especially at night, it could be a symptom of an infection in the bladder or prostate. Similarly, if you experience a sudden urge to urinate followed by the inability to hold it in, this could be indicative of overactive bladder issues. On the other hand, if you notice that you're dribbling urine after urinating, it might be a sign of a problem with the muscles that control the flow of urine. Other concerning symptoms include difficulty starting the stream of urine, a weak or interrupted stream, or pain during urination. These could be symptoms of an enlarged prostate in men or other urinary tract issues. While some bladder problems can be age-related, others may require treatment with medication or other interventions. It's essential not to ignore these changes as they can impact your quality of life and overall health. By being aware of the warning signs and consulting a healthcare professional, you can take proactive steps towards managing any bladder issues that may arise. Remember, early intervention is key to preventing further complications and ensuring optimal urinary health. 2. Chest pain or discomfort. If you experience chest pain or discomfort, especially when you're engaged in physical activity or emotionally stressed, it's crucial to seek medical attention promptly. This is particularly important for individuals over the age of 60, while chest discomfort can be a symptom of heart disease. It's not always the case. However, it is better to err on the side of caution and consult a doctor to determine the underlying cause. A doctor can perform tests such as an electrocardiogram, which measures the electrical activity of your heart, and blood tests to assess the levels of cardiac enzymes, which can indicate whether there has been any damage to your heart muscle. They will also ask about your medical history and lifestyle habits to gain a better understanding of your overall health and risk factors for heart disease. In addition to traditional risk factors like high blood pressure, high cholesterol, and diabetes, doctors now consider other factors such as obesity, physical inactivity, smoking, and heavy alcohol consumption. By addressing any modifiable risk factors and seeking appropriate treatment, you can reduce your risk of developing heart disease and improve your overall cardiovascular health. It's essential not to ignore chest pain or discomfort, as early detection and management of heart disease can significantly improve outcomes and quality of life. Don't hesitate to contact your doctor or seek emergency care if necessary. 3. Changes in appetite or unintended weight loss. As we get older, our metabolism slows down, which can lead to weight gain. However, if you're experiencing a sudden and unexplained decrease in appetite along with unintended weight loss, it's essential to consult a doctor. This is especially true for individuals over 60, as it could be a sign of a more serious underlying condition. A loss of appetite can be caused by various factors, including depression, anxiety, stress, and certain medications. However, it can also be a symptom of a medical problem, such as hyperthyroidism, diabetes, or cancer. Unintended weight loss can have a significant impact on your overall health and well-being. It can weaken your immune system, making you more susceptible to infections. It can also cause muscle loss and weakness, making everyday activities more challenging. Additionally, severe weight loss can lead to malnutrition and nutrient deficiencies, which can further compromise your health. That's why it is crucial to consult a doctor if you notice any concerning changes in your appetite or weight. With proper medical evaluation and treatment, you can manage any underlying conditions and maintain a healthy weight. By taking these steps, you can ensure that you're reliving your best life and enjoying your golden years with vitality and vigor. 4. Persistent cough or shortness of breath. A persistent cough or shortness of breath can be a concerning symptom, especially in individuals over the age of 60. While a mild cough can often be attributed to common causes such as allergies or a cold. A more persistent cough may indicate an underlying issue that requires medical attention. Similarly, shortness of breath, which can be a symptom of various respiratory conditions, should not be ignored. It's important to consult a healthcare professional to determine the underlying cause of these symptoms, as they can be indicative of a range of conditions, including chronic obstructive pulmonary disease, COPD, asthma, pulmonary fibrosis, or heart failure. These conditions can have a significant impact on your quality of life, making everyday activities such as walking up the stairs or climbing a hill more challenging. In addition, respiratory issues can cause discomfort, fatigue, and even lead to complications such as pneumonia. By seeking medical attention and receiving an accurate diagnosis, you can take the necessary steps to manage your condition and improve your overall health. With the right treatment plan, you can breathe easier and enjoy your life to the fullest. Number 5. Changes in mobility or balance. As we age, it's normal to experience some changes in mobility and balance. However, if you've always been active and suddenly find yourself struggling to move around or stay upright, it's important to pay attention. This is especially true for individuals over 60 who may be more susceptible to conditions that affect their balance and coordination. A sudden change in mobility or balance could be a sign of an underlying issue such as a vitamin D deficiency, inner ear infection, or stroke. These conditions can have a significant impact on your independence and quality of life, making it more difficult to perform everyday tasks and increasing the risk of falls and injuries. It's crucial to consult a doctor if you notice any sudden or dramatic changes in your mobility or balance. With proper medical evaluation and treatment, you can address any underlying issues and take steps to improve your stability and overall functionality. By prioritizing your mobility and balance, you can continue to live an active and fulfilling life, enjoying your hobbies and spending time with loved ones without limitations. When it comes to our health, it's always better to err on the side of caution. If you notice any warning signs in yourself or someone you love, don't hesitate to seek medical attention. Remember, early detection and treatment can make all the difference. Stay proactive about your health and well-being and continue to make healthy lifestyle choices. By doing so, you can enjoy your golden years with vitality and vigor. Thank you for watching. If you found this video helpful, please like and share it with friends and family who might benefit from this information. Stay healthy and take care.